So we are lucky to have Medicare today because this is not something that people always plan for. I meet people all the time. You're my ideal client, Bill, somebody that starts the research 6 years before you need Medicare. That is fabulous. But we meet plenty of them that are the day before they turn 65 trying to learn this stuff, which causes a lot of stress. So we recommend looking at it at least a year before you turn 65. The number one Medicare mistake is assuming that Medicare is free. We still get people, even now, with all of the information out there and very good podcasts like yours, distributing this information and trying to prepare people. We just had one recently in our private Facebook group who said, I'm getting ready to turn 65 and I didn't know how to pay for Medicare. And so that is mistake number one. Is I like to say there should be a class when you turn 50 that it's mandatory by the federal government that you go so that you can plan ahead for this, because it's not going to be free.
Welcome to Catching Up to FI, a podcast on mindset, money, and life for late starters of any age on their journey to financial independence. I'm Bill, and I'm a late starter.
I'm Jackie, and I'm also a late starter, and we're your host. We're here to help you on your journey to financial independence, no matter where you're starting.
We're going to talk to experts, other late starters, and explore topics related to our mission.
Join us as we catch up to FI together.
Hello, and welcome back to Catching Up to FI. We are fresh back from the Bogleheads Conference in Minneapolis, Minnesota, and we're on fire with stuff for our community. Today, we're going to talk about some really cool things, and I'll let Jackie introduce our guest, but I want to give a shout out first to Forget About Money with David Boyer. This is a fantastic podcast that has awesome guests, many of whom were at Bogleheads last weekend. So check out Forget About Money with our friend David Boyer. He's been on the show, and we can recommend anything he puts out there wholeheartedly. Next thing I want to do is give a shout out to a charity. We saw Paul Merriman at the Bogleheads Conference, and he has a wonderful charity called the Merriman Financial Education Foundation. He does great things for financial literacy. He's actually also established an entire curriculum that's required at Western Washington University for the students there. So if you want to go to Western Washington University, you'll come out as one of the most financially literate college students ever, probably. Lastly, I want to give a shout out to Kyle, 23C. He wrote us a fantastic review, and I want to share it with you. Although I'm in my 30s, I find this information quite valuable. Bill, Becky, and Jackie are honest, relatable, and thoughtful about their content. Additionally, the guests they bring on are exceptional at explaining concepts, or more often than not, the important mindset shifts that need to happen once the financial mechanics are solid. I also get to hear them explain things they wish they would have done differently earlier in life, which I can take advantage of now. Overall, great people that broadcast an enjoyable an informative show. Now, I have to say, too, in regards, I am selfish with this show, folks. This, as I learned from Christine Benz, is not research. It's me-search. I get to ask all the questions that I need to know. And today, we're going to talk about that exciting topic, just like Social Security. Drum roll, please. Medicare. All right, Jackie, take it away.
Yeah, Bill, the Medicare stuff, there's so many practical applications that are just not in the textbooks or things that we read from the academics. So we brought on who I consider, you consider, and I think most people consider the expert, the renowned expert on Medicare. So her name is Danielle Roberts, and she is founder at Boomer Benefits. It's a national insurance agency specializing in Medicare since 2005. She's the author of the best-selling book, 10 Costly Medicare Mistakes You Can't Afford to Make. We're going to dive into that. And it is a frequent resource for major news outlets such as CNBC, Fox, Yahoo Finance, Kiplinger, and MarketWatch. She has appeared on more than 200 podcasts, radio shows, and TV segments to educate the public about Medicare. So we're certainly honored to have her join us today as well. Danielle serves on the National Association of Benefits Insurance Professionals Medicare Advisory Group, where she advocates for Medicare beneficiaries at a national level to government organizations. Danielle has spent the last 15 years helping thousands of Medicare beneficiaries learn how to navigate their entry into Medicare. Her goal has always been to make the entry into Medicare and enrollment process easier for ordinary Americans. Danielle, welcome to the show.
Well, thank you. And thank you for that lovely introduction. I'm so excited to talk to you guys today.
Yeah, I mean, I'm getting closer and closer to Medicare age. It's a little intimidating. I turned 59 this month, and my goodness, 6 years away. So I'm getting my ducks in a row. I'm reading her book. I'm not all the way through it, but we're going to summarize a lot of the salient points that you should know about that'll encourage you to dive into her book and to dive into her website at boomerbenefits.com. So most of our audience is close enough to care, just like me. So can you take us back a little bit so that we understand Medicare? Let's go back to the quick history of when it originated and what it's evolved to.
Yeah, so Medicare was rolled out in the mid 1960s, 1965. Actually, Truman tried valiantly to get it passed during his administration and didn't quite make it, but he did get to be the first recipient of Medicare. He and his wife, Bess, were the first two holders of a bona fide Medicare card. And at that time, we had 19 million people in Medicare, and today we have around 67 million people. So it was good planning on their part. And when they rolled Medicare out in 1965, it was modeled after the old Blue Cross and Blue Shield style of insurance. So we have our hospital benefits and we have our outpatient benefits. And it stayed like that for about 40 years. So for quite some time, people on Medicare did not have good access to outpatient drugs. In 2006, Medicare Part D came on the scene, and this now allowed people to purchase insurance, which would help them with the cost of their outpatient medications. And along the way, they have added things like Medigap plans and Medicare Advantage plans so that you can shore up those benefits in Medicare, the things that aren't covered, which I'm sure we'll talk about today. And so we are lucky to have Medicare today because this is not something that people always plan for. I meet people all the time. You're my ideal client, Bill, somebody that starts the research 6 years before you need Medicare. That is fabulous. But we meet plenty of them that are the day before they turn 65 trying to learn this stuff, which causes a lot of stress. So we recommend looking at it at least a year before you turn 65.
Yeah, I'm really glad you mentioned that, Danielle, that a lot of your potential clients come to you right before 65. That is not the way to do it. So that is why we're trying to have this conversation with people that are close enough to care. So even if you're 10, 15 years away, I'm 55. Oh, geez, I'm 10 years away. That's crazy. But I'm 10 years. I want to know what to expect because it's such an important system. And a lot of retirees, if they're retiring before 65, they cringe when they have to think about health insurance. And it's almost like once they hit that Medicare, they're like, now I got something that I don't have to worry about. It's predictable. And we'll hit on some of the misnomers and people get so confused about it. So you gave us the quick history of Medicare, and it has gotten so confusing. Part of that history explains why they've been adding on and adding on. So I guess, how do people qualify for Medicare? And can you sort of, I guess, high level, tell us a little bit about that? Because not everyone will qualify for Medicare. How do you even qualify to begin with?
Yeah, that's a great starting point. So, Medicare was first designed just for people age 65 and older. So, simply just an age designation, because this is around the time when people retire and head off into the sunset. They no longer have employer group health insurance. And so, that is how it was originally created. And then I believe in 1962, they added on Medicare for disability. So, if you qualify for Social Security disability, after 24 months of that, you can qualify for Medicare. Medicare is also available for people with end-stage renal disease and Lou Gehrig's disease. And so that is the group of people out there that can come upon an eligibility period. We'll talk about those enrollment periods and why you shouldn't miss them, but that is when you can enter Medicare. And of course, today we have lots of people that work past 65, and so you don't have to enroll in Medicare depending on the size of your employer, but it is the primary insurance for most Americans 65 and older.
Okay, well, that's interesting because my brother has a disability, and I didn't know that it takes 2 years to qualify for it after you're on SSI disability to get Medicare. So you have to have something to bridge that gap in between, I guess.
Yeah. So if you have SSDI for 24 months, you will just get a Medicare card in the mail showing that you can start Medicare on that 25th month. And that is just because some of those people are under 65 and because of their disability, they can't work. They may not be married to someone that can provide them group health insurance. And so Medicare was opened up to them.
So Danielle, why just those two diseases? You said renal disease and Lou Gehrig's. Why is it just those two?
I think just because of the severity of those illnesses with Lou Gehrig's, you can have a quick decline and you're going to need 24 months out is not necessarily going to help you. And then with end-stage renal disease, there's a whole variation of levels of that. And so if you have to go to dialysis 3 times a week, it may be really difficult for you to hold down any kind of job that would be giving you meaningful employment that has group health insurance, and not everyone is married. So
Right.
those two diseases are just serious enough that they offer it sooner.
Okay, got you. And how can someone find out if they qualify for Medicare? Does this show up on your Social Security earnings statement? Like if they go pull that at SSA.gov, I think it has Medicare stuff on there, right?
It may be on there, but an easy way to find out would just be to go to mymedicare.gov and attempt to create
Oh.
an account there.
Oh, I didn't know there was such a thing.
Yeah, and you can track your Medicare enrollment there. You can track the other parts of Medicare that you may be enrolled in, such as an Advantage plan or a Part D drug plan. And of course, you could always just call Social Security or 1-800-Medicare to inquire if you think you're past that 24-month window and you never saw your Medicare card come in the mail and you think you do qualify for it. You can give them a call and see if you're actually enrolled, and you may not even know it.
Just like Social Security, you don't qualify for it out of the gates. You have to have a work history, right?
Well, you do for Medicare Part A. So Part A is our hospital coverage, and that you have to have worked at least 10 years, which they call 40 quarters here in the United States, to qualify for premium free Part A. But if you didn't have those 10 years of work history, you could qualify for premium free Part A under a spouse or an ex-spouse or even a late spouse if they had the proper work history. So today, most people, when they age into Medicare or join, they do have that work history and they get a zero premium. But at 65, even if they didn't have that work history, they could still qualify for Part A for being 65. They would just have to pay for it. And it's quite
Oh.
expensive. It runs around $505 a month in 2024.
And that's if they didn't qualify for it.
Yes.
You got to work, you got to get married, you can be divorced, but there are ways that you wouldn't necessarily qualify if you're not careful. You don't get married, you don't work, you're in trouble.
Yeah, you're
Yeah.
going to have to pay a lot more than your peers. That's correct.
So, Danielle, you started telling us about Part A. Why don't we step through the 4 or 5 main parts of Medicare? Now, be patient with us. We want to make sure we understand, because every time I hear these, I see this alphabet soup. I get really confused. So the first part you mentioned was Part A, which is hospital insurance. So I know some people think that Medicare is free. It's not free, but Part A, hospital, is. Is that right?
You can qualify for a zero premium if you have worked and you had FICA taxes deducted during those 10 years. So most of the time we meet people that have a zero premium for Part A. The only people we ever run across that don't tend to be immigrants. Maybe they've been here 5 years to qualify for Medicare, but they don't have the work history. Their spouse immigrated with them. They will end up having to pay for Part A. And then sometimes we run into certain school districts where teachers didn't have Social Security or Medicare benefits taken out. And if they're not married and they're single, I have, over the course of my career, run across a few of those who were single and ended up having to pay for Part A. Sometimes what they'll do is go and get a part-time job to be accumulating those credits.
Oh, yeah.
The smart ones will know this ahead of time, and so they get a part-time job just to be putting those credits together.
So let's make sure people know that if you don't have FICA taxes taken out of your paycheck, you've got to figure out another way to get that zero premium for Part
Yes.
Yeah. So the next one would be Part B. Tell us a little bit about that.
Yeah, so Part B is your outpatient coverage, and you and I think of this probably as doctor visits and lab work and preventive care, but there are actually many things covered by Part B, and sometimes they might even happen on a hospital campus. It could be something like an outpatient surgery. It could be physical therapy. You might be purchasing durable medical equipment, getting dialysis or chemotherapy or radiation. Those kind of things all happen on an outpatient basis. So if it's not part of an overnight stay in the hospital, then it's going to fall under Medicare Part B. And there's a wide variety of all sorts of things that get covered under Part B.
Yeah, well, I'm an emergency doctor, and I would fall under Part B. And emergency room visits are not cheap, right?
That's correct. Yes. And so those two parts together take care of the bulk of things that you may run into health wise. And so those are called original Medicare or traditional Medicare when you pair those together. And they're the only two parts of Medicare that you sign up for through the Social Security website, because the other two parts came much later in the program and they are optional, sold by private insurance companies. And typically people enroll in them through brokers like us at Boomer Benefits.
So is Part B also premium free?
No. So Medicare Part B has a premium, and most people will pay the standard base premium, which is $174.70 a month in 2024. There is a group of people that may pay less if their income is so low that it's close to the federal poverty level, they may qualify for both Medicare and Medicaid. And depending on that income level, Medicaid may pay some or all of the portion of that Part B premium. Then, on the opposite side of things, there are about 8% of Medicare beneficiaries who actually have higher incomes, and they get to pay more for Medicare Part B. This is called an income related monthly adjustment amount. In our industry, we call it Ugly Aunt Irma. Nobody wants to meet her.
Right,
She
right.
takes money out of your wallet. This is no fun. But in America, when we earn more, we pay more for lots of things. And so this is a way that they are bolstering the Medicare program and trying to keep it solvent for as long as possible. So if you earn more than $103,000 as a single filer, or $206,000 as a joint filer back in 2022, it's a 2-year look back, you will actually pay more for Medicare because you have that income related monthly adjustment amount. So people in the top bracket, I think they pay, it's over $580 a month for Part B. And imagine if you didn't know that and you didn't know that your income was going to put you into that potential. We occasionally meet people like that who end up working a few more years just to try to put away more money because they were anticipating Part B was going to cost them $174 and it ends up being 500 something. You don't want to be caught off guard by that.
So you mentioned something important that was confusing to me, and that's the look back on your income. If you take Medicare at 65, they're looking all the way back to 63 for what your gross income or your MAGI, your modified adjusted gross income was at that point, right?
Yeah, that's right. And so if you think about this, decisions you make with your money when you are 63 and 64 can impact what you will pay for Medicare when you're 65 and 66. So this is such a good reason to have a financial advisor, somebody that works with you that may advise you, hey, if you're going to retire early and take a big severance from your job, maybe we want to do that when you're 62 so it doesn't inflate your Medicare premiums when you're 65. These are all things we have to plan for. And then also I will share that they give you a new benefit determination letter every year. So if your income goes down 2 years later, that will catch up with you. But you can actually appeal it ahead of time if you have a valid reason for a change in your income. So some of those valid reasons are a retirement, going from full-time to part-time, marriage, divorce, death of a spouse, or sale of an income producing property. These are examples of reasons why you could file a reconsideration request with Social Security to say, here's my documentation that I did earn that money back in 2022, but in 2024, now I've retired, here's my income. We actually did this for my mom and was able to get her premium lowered right away instead of her having to wait those 2 years for it to catch up.
Yeah, I mean, that sounds like a really important piece because people don't know that they can appeal. So if you retire at 65, take Medicare, and your income, and you had a transition to complete retirement over the course of those previous 2 years and your income was dropping, you can appeal to go back and get lower premiums, correct?
Yes, that's right.
Yeah, these are some great proactive planning things that even if you're a little bit far out, consider those things. Now, so we talked about Part A, which is hospital, Part B, which is outpatient and doctor visits and things like that. So naturally, we would think we'd go to Part C, but I think we'll skip that for the moment. And because in both of those, you never mention drugs. And for our workplace healthcare plan, it does include drugs. So drugs is yet another separate piece. That's Part D. I can remember that, D for drugs. So tell us about Part D, the drug part. And I don't know if you know about maybe the average cost of that as well.
Yeah. So Medicare Part D was necessary, right? Because in the last 50 years, we have seen huge advancements in modern medicine and pharmaceuticals. So maybe that wasn't so important back in the 60s as it is today. And so they had to come up with a way to provide this benefit. I can remember people paying $10,000 a year for their diabetes medicines because Medicare didn't have drug coverage. So they fixed this, of course, with the rollout of Medicare Part D in 2006. And this is just a way for you to enroll in an insurance program for outpatient medications. So this doesn't cover the drugs that might be injected in your doctor's office. Those will still fall under Part B if a physician has to administer them. But anything that you pick up yourself or order through mail order, a Part D drug plan is going to provide that for you. And the average Part D drug plan in 2024 runs around $55 a month. Some people may pay less or some people may pay more depending on the medications they take. So, all Part D drug plans cover certain classes of medications. They must cover anti cancer, anti seizure, antidepressant, and a couple of other categories. Beyond that, they only have to cover 2 medications in every therapeutic class. And so you might have a really bare bones Part D plan with a lot of generics and maybe not so much of the richer brand name formulary. These will tend to be cheaper. You may have some that are over $100 a month and have wider coverage for those brand name drugs. And so when you shop your Part D drug plan, one of the things that we do at Boomer Benefits is we take your list of medications, we plug it into a search engine that we have. It crunches the numbers of all the drug plans and will tell us exactly which plan is the most cost effective for you, not based on the premium, but based on what you are going to spend on your medications on that specific plan. And so we give a ballpark of, say, 55. There are plans out there as low as 0. Those are not my favorite because we never know when we're going to get sick and need a very expensive medication. But sometimes if you're somebody that's really healthy and you don't take a lot of medications, maybe you do that for a year, and then every year in the fall, you have an opportunity to change your drug plan. So if new things crop up over the year, maybe you don't have good coverage on your current plan for a certain drug, we could look at switching you in the fall so that you have better coverage next year for that medication.
So D is drugs, but have there been some big changes in 2024 that we should know about?
Yeah, the Inflation Reduction Act was passed a couple of years ago. And one of the important things it did that's happening in 2025 is it's going to bring your out-of-pocket maximum on medications from $8,000 down to $2,000. And prior to that, it used to be that there were 4 stages. There was a donut hole in the middle where you could pay more for your medications than you did before. And then even when you hit catastrophic coverage, you still had to pay 5% of your medications after that. And so over the last few years, as the Inflation Reduction Act has phased in, we have seen people have their costs lowered each year as they go. Everyone is looking forward to the $2,000 cap next year. That'll be quite a relief for some people. However, there are some unintended consequences of that legislation in that we saw the insurance carriers come out with much higher bids for Part D. We were quite concerned that this was going to mean all of a sudden people were going to pay $200 a month on their Part D drug plan, which would probably mean everyone rolls into Medicare Advantage and doesn't do Medigap anymore. And CMS came out with a premium stabilization program to subsidize those insurance companies to bring those premiums down. And so we're lucky that heading into next year, we sort of had that same range of plans from 0 premium all the way up to $100 a month or more, so that we have good choices. But we did see some Part D companies pull out of the market saying thanks, but no thanks. And we have the other companies offering less plans. So we had 24 or so national plans last year, and this year I think it's around 14. So we are concerned to see if the insurance companies can weather the changes. And this is something that should make any listener that is on Medicare really careful this year. Review your annual notice of change packet from your Part D carrier. Make sure they're not dropping an important medication that you take, because if so, we want to use this upcoming annual election period to get you into a different plan that will still cover that medication.
So let's rewind a little bit here. That was a lot. That was a mouthful. So
For sure.
Number one, there is an IRMA surcharge on Part D as well, too. We see that at Part B, but we
Yes.
also see it at Part D. Can you explain that?
Yes. So if you enroll in a Medicare Part D drug plan, let's say we find you a plan with a $20 a month premium. You're going to pay that premium directly to the insurance company, however you designate it on your application. Maybe you chose bank draft or a coupon book. You'll pay your premiums that way. But if you're in one of those higher income brackets, they will also tack on an IRMA charge, and they will deduct this from your Social Security check before it ever hits your bank account. Or if you're not taking Social Security yet, they'll bill you for it quarterly. And so this IRMA charge could be as low as $12.90, but it could be as high as $81. And this is where it gets tricky, right? Because maybe you're a person that doesn't take medications, or you've got 1 or 2 little generics, and you may not be excited about having a plan premium plus an IRMA. But if you don't enroll in Part D, and you don't have other creditable drug coverage, like through an employer or through VA benefits, then later on, when you go to enroll in Part D, you'll pay a penalty that they penalize you every month for the rest of your life. And this penalty grows with time. It's 1% per month of the national average premium. So let's just say that you waited 5 years. Now you sign up for Part D, you're going to pay a 60% higher premium every month forever. And the bigger thing is, and this is a really important risk that people should know about. If you fail to enroll in Part D, you can't just add it any old time later. You pretty much are going to be limited in most circumstances to adding it only during the annual election period. So let's say you skip Part D and then now in February of the following year, you're diagnosed with cancer and you need an oral chemo med that's $9,000 a month. You will pay that out of pocket until we can get you in a drug plan the following January. So there is a big, big risk to not enrolling in Part D, but you can see why people might sometimes be tempted if they're not taking a lot of medications and they're pretty healthy. We're giving them all of these numbers and then they have to make the best judgment call for themselves.
Well, insurance is for catastrophic things, and cancer is obviously catastrophic and catastrophically expensive. This show is sponsored by Boomer Benefits, one of the nation's leading family-owned Medicare brokers. Jackie, I am so confused about the alphabet soup in Medicare.
Oh my gosh, Bill, I am not the only one. And I'm a financial professional and I learned all about this stuff, but it is still confusing. But the truth of the matter is most of us are close enough to care about Medicare where we have to figure this stuff out no matter how confusing it is. So Boomer Benefits is here to educate you and to guide you every step of the way when you're ready to make that big decision.
So with Boomer Benefits by my side, I'll receive personalized Medicare guidance tailored to my health and my financial needs, all at no extra cost to me.
Yeah, Bill. And they can help evaluate which Medicare options are best for you based on your unique situation. And if you're already on Medicare, they can review your current plan and make sure that it's the right fit.
So let's visit boomerbenefits.com today and let them help us make informed decisions about our Medicare coverage. Gosh, Jackie, this is a godsend. I'm definitely going to do this.
That's right. They are the best.
The other thing that you mentioned too was that there's sort of a total cost here between A is a zero premium, Medicare B has a premium plus IRMA, and Medicare D, the drug plan, has a premium plus IRMA. So give us the average American. And remember, these premiums are per person. Mm-hmm. We think about family coverage sometimes, but you're paying this twice when everybody reaches 65. And you're going to have another insurance plan for your spouse or partner who's under 65 when you age in. So at any rate, can you take us through what the average cost is for the average American who takes, say, for example, Medicare A, Medicare B, Medicare D, and Medigap, which we'll talk about in a minute, G, which may be the most common plan. What are we looking at for costs?
Yeah, so we actually do a cost breakdown like this when we do our webinars at Boomer Benefits. And so we kind of line it all out for them showing, hey, if you're going to go with the Medigap route, let's look at how this stacks up. And if you go with Medicare Advantage, let's look how this stacks up. Because you have to maintain both Medicare Parts A and B, no matter which supplemental coverage you choose. So for a Medigap plan, you're going to have your Part A, which is a zero premium for most people. Part B, $174.70 for most people. 8% of people are going to pay more than that with an IRMA. Part D, we said a ballpark is 55. So that's just a good number to use if today you're just listening to try to plan ahead for what you might spend at some point. And then a Medigap plan is going to depend on where you live. So if you live in the Midwest or even here in Texas, if we had a female non-smoker, non-tobacco user aging into Medicare at 65, we might be able to find her a Plan G, which is the most popular selling Medigap plan, for around $120 a month. If it was a male, it might be $150 a month. And so when you add that all together, you're looking at around $350 out of pocket, but you have a plan with a $240 deductible and 100% coverage after that. You don't even have a doctor copay, just a copay on your prescription. So very comprehensive, but Medigap plans have rate increases every year, just like any other type of insurance. So you can expect those premiums to go up 13 to 15% per year. And you have to be looking at the big picture to say, how long could I sustain this kind of premium out of pocket? And that is something you want to look at when you're choosing between a Medigap plan and a Medicare Advantage plan. Also, if you lived in, say, Florida or New York, you could add on about $200 a month in premiums for Medigap, because in certain areas, the cost of healthcare is higher. Some areas like New York have year-round open enrollment. So if the underwriter can't underwrite out the sick people, they raise the rates on everyone. So a lot depends on where you live as well in terms of what a Medigap plan would cost you.
So, Jackie, let's rewind for a second because she threw out these terms Medigap and Medicare Advantage. And this is part C that we want to talk about, right?
Advantage plans are Part C, yes.
Yeah. So, okay. So to, I guess, clarify, sometimes a visual is good, but if you're just listening, so when we hit Part C, this is sort of fills the gap. That Medigap is sort of fills the gap. And you come at a crossroads, right? You can either do one of these Medigap plans. The example we just did was G, like George, but you can choose another alternative.
Yes.
And tell us the difference in those. I think this is where, including myself, most people get very confused. And what we see as consumers is just a lot of commercials with like JJ from Good Times. I watched Good Times when I was a kid. So, but there's a lot of actors and well-known people promoting what's called Medicare Advantage. So that's what we're constantly messaged to. But that's not the only option. That's an alternative to Medigap. So can you step us through that and help us understand the difference and the pros and cons?
So for a long time, all we had was Medigap plans. So you would either have original Medicare by itself and pay it all the out of pocket yourself, or you would have that in a Medigap plan. And let's back up for just a minute to say that Medicare Parts A and B do not cover 100% of all your medical expenses. This is one of my mistakes in the book, which is actually chapter 2. People think it's national health care. It's probably like Canada. I'm just going to go in and everything will be free. And that is not the case. So just like with insurance that you've had under age 65, you have costs that you pay at the time of healthcare services. This includes on the hospital side, a $1,632 deductible. If you spend even 1 night in the hospital, you're going to pay that. That will cover your first 60 days. But if you're in the hospital still on day 61, you start paying a $408 daily hospital copay, which doubles to $816 on day 91. And on day 150, all of your hospital benefits run out. You also will be responsible for paying the first 3 pints of blood in a transfusion. And if you are transferred into a skilled nursing center, Medicare covers the first 20 days. But if you're still recovering from whatever surgery or stroke that happened, and you need to be in there longer than 20 days, you start paying a $204 daily copay for the skilled nursing facility. On the Part B side, there's an annual deductible of $240, and then after that, Medicare only pays 80% of your outpatient expenses. You pay the other 20% forever with no cap. And so the reason that Medigap plans were created back in the 60s is to pick up those things for you, to pay those hospital deductibles, to pay those daily copays, to give you an additional 365 days of hospital coverage. And then depending on which Medigap plan you choose, might also cover that skilled nursing piece. Medigap plans also cover that 20%. And so those were created so that when you go have care and Medicare gets the bill, Medicare pays its share. And then rather than sending you the remainder to let you pay all your deductibles, copays, and coinsurance, if you sign up for a Medigap plan, it sends that remainder to the Medigap plan. And then they pay on your behalf. And you only have spending left over after that point, if any, depending on which Medigap plan you choose. And so the Medigap plans are basically to supplement, that's why we call them sometimes Medicare supplements, to supplement Medicare so that you don't have to worry about those kind of out-of-pocket expenses. And Medigap plans allow you to seek care from any provider in the United States that accepts Medicare. So you don't have to ask your provider, do you take Blue Cross, do you take Humana? You just say, do you take Medicare? If they say yes, that Medigap plan is going to pay exactly like it's supposed to. And so people choose Medigap. When they choose that option, it's usually because they want that freedom of access to go anywhere in the nation. Maybe they're thinking, if I have a history of cancer in my family and I know that the best specialist is at the Mayo Clinic, I want to have that option to be able to go there if I need to. And so you pick a plan with that access. You don't have to have a primary care doctor. You don't need to get a referral to a specialist. And then you have to add on the Part D. So this type of coverage is more expensive, but you're paying for that freedom of access to go wherever you want and to have pretty solid coverage on the back end. So you're not really losing sleep at night about what's going to happen when you come out of the hospital. Medigap plans are really comprehensive.
Quick question. I raised my hand. How many different Medigap plans are there? That's where the alphabet soup really comes in. We don't need to go through all the individual ones, and N and G are the most common. And I've kind of decided I'm going to go with G just based on what I learned from you already. But what are the differences? What are they slicing and dicing just how much they're paying and what services they're paying for?
Yes. And so there's a chart that compares them. And right now there are 10 Medigap plans. And why the federal government labeled them with letters when Medicare itself is already labeled with letters, we'll never know. Roman numerals would have done the public a great deal of good, because people might say, I want a Part G. Well, there's no such thing, but we're going to know what you meant. There's a Plan G. So Medicare has parts A, B, C, and D. Medigap has plans A, B, C, D, F, G, K, L, M, N. The missing letters are plans that have been retired, and Medigap plans F and C are also being phased out right now because there was some legislation that passed that said they don't want you to purchase a Medigap plan that picks up the first dollar out of pocket. They don't want it to cover that Part B deductible of $240. They want everyone to have a little skin in the game when they're choosing whether they need to seek healthcare. So the reason that very few people sign up for Medigap plan A, B, C, or D is those plans have less coverage. For example, on Medigap plan A, it doesn't pay the $1,632 hospital deductible. Well, most people on a fixed income, they want to have good coverage on the back end. They want to know that they're not going to come out and find 17 bills waiting for them in their mailbox. That's going to be thousands of dollars. So that is why over time, what we've seen is that people by and large enroll in the plans with the most coverage. And right now, those two plans are plans G and plan N.
Okay, and this segues into your question, Jackie, about Medicare Advantage then, I guess, right? Would that be our next place to go?
Yeah, I got one quick question, Danielle. So is there any plan within Part C that has a maximum out-of-pocket cost?
Yes.
Okay.
So let's say that you look at the Medigap option and either you can't afford it, or you look and see that the rate increases will be kind of unsustainable, or maybe you're just really healthy and you don't go to the doctor very often, and sure, you don't want to spend all this money on a plan that you may or may not use. Right. This is why Medicare Advantage plans were created. And Advantage plans are a private insurance plan that offers you a network of providers in your local area. So now, instead of having Medicare pay your bills, you are going to have your providers submit your bills to the Advantage plan. These plans have lock-in periods, and so if you enroll in one, you need to know that ahead of time. It's not always easy to get out of one. You can only do that at certain times of the year. So an insurance company will come into an area, maybe contract 10 or 15,000 local providers, and they create a network, and those providers deliver discounted care to the insurance company's members. Doesn't this sound familiar? It's just like group health insurance. Right. An Advantage plan will create for you usually it's either an HMO network or a PPO network. There are some hybrid versions, but in most areas, those are the two. We're all familiar with these. HMOs are a little more restrictive. You're going to choose a primary care provider. You might need a referral to see a specialist, and you will have no coverage outside of your home local area except in an emergency. And those are a little more restrictive, but they also are typically the lowest premiums and the lowest copays and the richest benefits. So on an Advantage plan, you agree to get your healthcare services from that network, and your premiums are very, very low upfront, and you pay copays and deductibles and coinsurance as you go. And this appeals to a wide variety of people, especially if they don't use a lot of healthcare services. So the Advantage plan, when you enroll in an Advantage plan, the federal government pays the Advantage plan over $1,000 a month plus bonuses to take on your medical risk. So if they can provide you healthcare services for less than $12,000 a year, plus whatever bonuses they attain, then they're making money. And if you look at United Healthcare stock, you can see they're the largest Medicare Advantage provider in the US, and they're doing just fine. And so you may find that these plans will offer premiums really, really low because they're getting paid so much money by the federal government when you join. So if you had an HMO with the Medicare HMO plans, a lot of times what we see is a zero premium, which means you don't pay anything more for the plan itself other than what you're already paying for Part B. And then when you open the summary of benefits, which is something we do with all of our clients at Boomer Benefits, if we're looking for an Advantage plan for them, we open the summary of benefits and we show them for each healthcare service what they will pay. So this might be $5 at the primary care doctor, $25 at the specialist. If you go in the hospital, it might be $200 a night, but it's capped after 5 nights. And Advantage plans all have that maximum out-of-pocket cap, Jackie, that you mentioned. So because you have some spending that can happen on the back end, they have to cap what you potentially can spend on Part A and B services. And in 2024, that out-of-pocket can be no higher than $8,850 in the network. So when someone reaches out to us at Boomer Benefits, we are looking to see what plans can we find in their area that have their doctors in the network, their necessary drugs on the included built-in Part D drug plan, which is an important feature, and can we find one with a lower out-of-pocket? Because they all compete. And if they might have a $5,000 out-of-pocket limit as opposed to an $8,850, that's going to be best for our client. And then the second piece of that question is, where are they going to go and have healthcare? If they know they're only going to treat locally at home, we might find a really rich Medicare HMO for them. But if we know that they want to have access to see doctors outside the network and willing to pay more for it, then we might look at a Medicare Advantage PPO network where you have a little bit more flexibility.
I got it. I understand it. I understand the language. You're probably going to have to listen to this episode 2 or 3 times and then read the book.
True.
But it sounds like there's a lot of sliders here. It's much like sliding the interest rate and the principal payment on a mortgage or a car loan. And you can adjust things up or down, and you got to make sure you plug in your drugs to make sure they're covered and your doctors to make sure they're in network. So doing an Advantage plan gives you a lot more control over your costs, but it adds a lot more complexity, right?
For sure. It absolutely does.
So this decision comes up every year. You can choose to switch back and forth, right?
Well, that depends as well. So let's say you're coming into Medicare at 65 and you sign up for Medicare Part B. Most of the time you're signing up for A and B, but some people delay Parts B because they're still working, and we can get into that a little bit later. But whenever you sign up for Part B, you have one opportunity, a 6-month Medigap open enrollment window, during which you can choose any Medigap plan that you want that is offered in your zip code, and they cannot underwrite you. It's a rubber stamp approval. That is the only time in most states that you will not have to answer health questions. Once that 6-month window passes, now if you want a Medigap plan, you're going to answer a whole page of health questions. They're looking for you to say no to all of those questions. They're going to look at your medical records, your prescription records, and then the underwriter can accept you or decline you. So if you come into Medicare, let's say you have a serious health condition, something that is chronic, it's treatable but not curable. Let's use rheumatoid arthritis as an example. We're going to know that if you want a Medigap plan, we need to get you covered in that 6-month window because later on you probably will not qualify.
Wow.
So if you start with that type of coverage, it's really easy later on down the line to switch into a Medicare Advantage plan because Advantage plans don't have any health questions. There's no underwriting, but therefore the government, just like we do with ACA plans under 65, limits you to a certain window of time each year when you can sign up for one. So if you were on a Medigap plan for a few years and you incurred all those rate increases and that was so expensive for you, you might come to me and say, I can't afford this anymore. We could easily switch into an Advantage plan. Whereas if you went the other direction and started with an Advantage plan and you had that for a few years, and now all of a sudden you have a health condition and you're starting to spend a little on your Advantage plan because you have more healthcare services, you want to go back to original Medicare, we can get you there during any annual election period. You can leave the Advantage plan and go back to original Medicare, but will you be able to pass the underwriting to get the Medigap plan? And in most states, it works like that, although there are a handful of states with expanded open enrollment rules.
So in some ways, it's a one-way street, and you got to make sure you're driving the right way down the street.
Yeah. So I'm thinking the Medicare Advantage, they have one big disadvantage, and that's that you cannot go back into the Medigap without having to have that health underwriting, which for some people that are getting older, post 65, like you said, could be an issue with that rheumatoid arthritis. Okay, that is really good to know. So we hit all 4. Is there anything else we need to know about these 4? Oh, Bill has a question. What's up, Bill?
The reason that people go Medicare Advantage is because of cost savings. What would be the average cost savings, say, between a Medigap G and a middle-of-the-road Advantage plan?
Yeah, so in 2023, 7 in 10 Medicare Advantage plan had a zero premium. So in most areas, maybe Alaska and Wyoming are examples where it'd be a little more difficult, but in most areas, especially urban areas, you're going to find a bunch of plans that have a zero premium. So you would have Part A is zero, Part B, the 174.70 plus any IRMA you may owe. Part D, nothing, because most Advantage plans have a built-in Part D drug plan, but now you will have some doctor copays as you go. So for around $174 a month, that would be your Medicare Advantage, which is about half what we quoted you on the Medigap side. And this is why today 55% of people on Medicare are enrolled in Advantage plans, and they anticipate that that will be 70% by 2030. There's inflation and lots of other things impacting our seniors right now. So sometimes that Medicare Advantage plan may be just more comfortable for them in terms of what they can spend every month out of their own pocket.
But you got to plan on being healthy until you die suddenly, because the problem is you get that chronic disease that has high cost and you can't go backwards.
In most states, that could be true, yes. And so what we tell people when we have someone that calls us that's interested in an Advantage plan, we have some tips for them. Number one, have a rainy day fund. If you have an HSA left over from your working years, which you've piled tens of thousands of dollars into, such a great thing, because now every time you need out-of-pocket spending on your Medicare Advantage plan, you've got that cash in your HSA. Or if you don't have that, maybe you're the kind of person that if you got quoted $150 a month for a Medigap plan, you're going to go the Advantage route, but you're going to put that $150 a month into an emergency medical savings account that you don't touch until you have an emergency. That's good. Another thing is, usually on Advantage plan, cancer costs are the most expensive. On an Advantage plan, you can pay up to 20% on cancer treatment, chemotherapy, radiation, but there is that cap, right? Well, we could pair you with a inexpensive cancer policy lump sum that might cost $25 a month, but it's going to pay you cash benefits if you get diagnosed with cancer. So you could do those together, still pay a lot less, and have an Advantage plan. So there's a lot of moving parts here, just like you said, what people have to think about themselves, their own health history, their family health history, what they expect to encounter. Can they find a plan with their doctors in the network? Usually that's a no-brainer. If your most important doctor doesn't take an Advantage plan, you're probably going to go the Medigap route. And then we're looking for a Medigap plan that you can afford.
It sounds like you need a decision tree for your decision tree.
A huge decision tree. So Danielle, we love HSAs around here. They call me
Yes,
the
me
HSA
too.
maven. Okay, awesome. So I have a couple questions about that. So I
Okay.
know that you can use HSA dollars, existing HSA dollars, to pay for certain premiums when it comes to
Yes.
Medicare. So can you talk to us about
Mhm.
which parts you can actually use HSA dollars to pay the premiums?
Yeah, so you could reimburse yourself out of your HSA for your monthly Part B. That's $174.70 a month. You can pull that out of your HSA. You can use it for Medicare Part D premiums. I'm not sure about Part C. I think all of them, but I would have to double check on the Part C. Most of them have a zero premium, so it doesn't usually come into consideration. And then as you are using those benefits, you can pay your deductibles, copays, and coinsurance from those HSA funds. What you can't use your HSA funds for is to pay for a Medigap plan. That's private insurance. And so you wouldn't be reimbursing yourself for that part.
Right. Yeah, I learned about that. And I'm like, why is that the case? But that's something to keep
Yeah.
in mind. But because we just discussed how some of these out of pocket costs can start to add up, the co-pays and things like that, you can use your HSA dollars for that. So that's important. And for planning purposes, so if you decide you want to be on a high deductible plan when you're young and healthy and you don't need to use those dollars, you want to invest it, there's a huge application in retirement to put that money towards your healthcare expenses, because Medicare is not free. We just talked about all the things that you have to pay for. So if someone's 10 or 15 years out, this is a great place to start planning for. So thank you for clarifying that.
Our HSA Maven took us through a 2-episode series that is just airing now. So look back at that and we can link Medicare to HSAs, which is awesome. I think, as Jackie does, that HSAs should be unlinked from a high deductible savings plan, that every American should have access to an HSA.
Agreed.
For these reasons alone. So talk to your congressperson and let's get this out there and done so that everybody has access to this great retirement vehicle. Before we continue, let us pause and share some words about one of this week's sponsors, Delete Me. You ever wonder how much of your personal data is out there on the internet for anyone to see? More than you think.
Oh my gosh. Yes, Bill. I mean, your name, your contact information, social security number, and home address, even information about your family members. And it's all being compiled by data brokers and sold online. Oh, that's so scary. But data brokers make a profit off of your data. Your data is a commodity, and anyone on the web can buy your private details.
Yeah, Jackie, I had my ID stolen, and that's why I now use Delete Me. Delete Me is a subscription service that removes my personal information from hundreds of data brokers. With Delete Me, I get a regular personalized privacy report showing what info they found about me, where they found it, and what they removed.
Yeah, and Delete Me is not just a one-time service. They're always working for you, constantly monitoring and removing the personal information you don't want on the internet. And to put it simply, Bill, Delete Me does all the hard work of wiping out you and your family's personal information from data brokers' website.
Yeah, Jackie, I am so grateful to this product because I now feel safer knowing that people aren't selling my information and they're not going to be able to impersonate me.
Yeah, what peace of mind, right?
All right, so take control of your data and keep your private life private by signing up for Delete Me. Now at a special discount for our listeners, go to joindeleteme.com/catching up. That's joindeleteme.com/catching up.
So we hit a lot of things, Danielle. We'd love to get into your book and those 10 mistakes. So
Okay.
I think we've clarified the parts and the plans and the out of pocket and all of that. But you see a lot of people every year. Your business is probably one of the largest in this whole Medicare space. And you wrote this awesome book to make people aware of the common mistakes. So hopefully we won't do them. So take us through some of those. What was the first one?
Yeah, I actually talked with my client service team about this because they're the ones helping people with all the hiccups that happen with Medicare on the back end and helping people fight penalties. And so I worked with them to say, if we looked at all the clients we've had over the past 15 years or so, what are the most common mistakes? And then we took those mistakes and created a special Facebook group, and we asked people about, did you make this mistake and how did you make it and why did you make it? And got input from actual Medicare beneficiaries. And what we came up with were these 10 parts. And the number one Medicare mistake, number one, is assuming that Medicare is free. We still get people, even now, with all of the information out there and very good podcasts like yours, distributing this information and trying to prepare people. We just had one recently in our private Facebook group who said, I'm getting ready to turn 65 and I didn't know I had to pay for Medicare. And so that is mistake number one. Is I like to say there should be a class when you turn 50 that you're mandatory. It's mandatory by the federal government that you go so that you can plan ahead for this, because it's not going to be free. And even if you choose a zero premium advantage plan, you still have that Part B expense. So that is mistake number one.
Okay, well, and even though the government doesn't currently mandate a class, we're giving this class today to our listeners. That's 10, 15 years out or whatever to hopefully help. And that's why, again, it was really important. We've got a lot of listeners that are not quite 65, but we want them to plan for it and to know big things like this. Medicare is not free.
Well, actually, this is a good point because Jackie's all about education, as am I, and as is Danielle. And when is a good time to do this? Because we talk about financial literacy education, but it's not just money. It's about insurance, which is a huge component to our financial lives. And we should have classes at some point early in life and repeatedly on Social Security and Medicare, the things that everybody's going to participate in. You've got to learn the foreign language. When is that time right? Well, we need to discuss that and figure out, okay. And I bet you in our local communities, there are classes for retirees through your local governments where they're doing this. You just got to be careful who's giving you the class.
Yes, that's true. Yeah.
All right, let's take a look at number 2. So expecting that Medicare covers 100% of your healthcare costs. We got into that a little bit. That's a big mistake.
It's a big mistake, and just because it's national healthcare doesn't mean it works like it works in Canada or in the UK. In America, we have out-of-pocket costs on under 65 insurance, and we have out-of-pocket costs on over 65 insurance. And so you just need to know that you'll be responsible for those deductibles, copays, and coinsurance unless you purchase either a Medigap plan or Advantage plan to sort of supplement that for you.
Yeah, I'm sure I would have messed this one up, but the next one is missing your initial enrollment period. So, how does those periods work? Because they can be critical, and if you screw them up, it could really mess things up for you.
So you're eligible for Medicare at 65. And one group of people will be auto enrolled into Medicare, and that is anyone that started their Social Security retirement benefits prior to their Medicare date. So if you start Social Security at 62, they're going to assume you're no longer working. You probably don't have health insurance, and they're going to auto enroll you in Medicare. Your Medicare card will show up in your mailbox 1 to 2 months before you turn 65. It'll have both a Part A and a Part B effective date. And so those people are auto enrolled. But we know here in America, many people now delay their Social Security benefits until their full retirement age or until age 70 to get that maximum check. And if that's the case, then you need to enroll yourself into a Medicare during an initial enrollment period that's specific to you. So it's going to start 3 months before your 65th birthday. It's going to go through that birthday month and then run for 3 months after. And so you have a 7-month window to sign up for Medicare Parts A and B. And you don't want to miss this window, because if you do miss it, then for every 12 months that you should have been enrolled in Part B, they're going to stack on a 10% cumulative premium. I once met someone that missed it by 7 years, and he was paying a 70% higher Part B premium for the rest of his life. He was just a healthy person. He's got some advice from Social Security, he said, that was incorrect. I wasn't there for that conversation, so I don't know if that was the case or if he just misinterpreted it. But yeah, he ended up getting smacked with that penalty. Most people don't do this because they want to set up health insurance when they're retiring. They don't want to be uninsured, but it does happen where people can miss it.
Wow, that is a horror story. My goodness.
Yes.
I
Yeah.
mean, it's buyer beware and buyer be blind. Don't go blind into retirement, basically.
Exactly.
All right. So don't miss your initial enrollment period. But number 4 on this list is skipping Part D without other coverage.
Yeah. So we talked about that you can only get into Part D at certain times a year. And so I have an example in my book of a client that every year I talked to her about her Part D. She was healthy. She didn't want to spend, and there were plans back then around $10 a month. And she didn't want to spend that. And she called me one year, and it was in September, and she had been diagnosed, if I recall correctly, with lymphoma. And she needed a medication that was $5,600 a month. And she paid that out of pocket for 4 months until I could get her into a drug plan. Fortunately, she had those funds available, but wow, the difference that she spent by waiting when she could have just had that drug plan all along. And then don't forget, she also got smacked with a penalty after that on her Part D when I did enroll her, because she enrolled late. And so for every month that she had waited, she had that penalty on the Part D. And so I don't recommend that anyone skips Part D. And in fact, I cover this in the book. My dad is a Vietnam War era veteran. And he, of course, decided that he didn't need anything but Part A. He was going to treat at the VA the rest of his life. And his daughter, being a Medicare expert, said, "You're absolutely not doing that. We're enrolling in both Parts A and B, because one thing I know about my dad, he's not going to sit in a chair and wait for an appointment for 2 hours. That will just never happen. He's going to leave." And although some VA clinics in America are timely, some of them just aren't. And so I said, "I'm going to sign you up for Part B. And we're also going to sign you up for a drug plan. In fact, I will pay for the drug plan myself, because it's so important to me that you have it. Because if you go to the VA, you can get your drugs through the VA. If you go to a civilian doctor, you cannot fill that prescription at the VA clinic." So we, of course, enrolled him in this and got him all set up. He tried the VA for like 2 appointments and then has never been back and refuses to go there. So having that Part D coverage was important, because he had some health conditions that would have made his medications cost around $700 a month out of pocket. But because I had that drug plan for him, he was able to pay somewhere in the neighborhood, I think, of $47 for both of those brand name drugs. So you don't want to skip Part D unless you have other coverage that you know you can rely on. And even if you're a veteran, I would at least consider getting an inexpensive, the cheapest Part D drug plan you could get, just so you have the option in case you do treat with a civilian doctor and you need to fill a medication outside of the VA clinic.
Well, Part D sounds very reasonable, right? Part D, the cost of it.
Especially now, yeah, it does.
So it is not automatic, though, right? They have
That's
to
right.
proactively sign up for Part D. So it's not like Part A and B, where when you turn 65, they'll just enroll you. Part D, you got to do that on your own.
Yeah. So you have even with A and B, you're going to enroll yourself in that 7-month window if you're not taking Social Security yet. But that same 7-month window, you have that initial enrollment period for A and B. You can sign up for a Part D drug plan in that same window. And then if you do that, you're going to know you're not going to get hit with a penalty later on.
Okay. Yeah. I mean, there are very important things that the bottom line is here. Inform yourself, learn the language, but go to Danielle at Boomer Benefits and you won't miss out on all these options. Yeah, absolutely. We love partnering with you. The next, number 5, and you need to explain this one to me a little bit. You fail to keep and submit proof of your credible coverage.
Yes.
That sounds like a bunch of alphabet soup to me. Can you take that apart?
Yes, it does. So let's say that you work past age 65 and you decide not to enroll in parts B or D or both because you're still working for, let's say, a large employer that has 20 or more employees. In that scenario, when you work for a large employer, you could delay Medicare and sign up for it later because that large employer coverage is primary and Medicare is secondary when it's an employer that has 20 or more employees. So when you leave that coverage, let's say you work until you're 68 and you retire now. When you apply for Medicare Part B on the back end, you have to have an employer verification form filled out by your employer to make sure that you have proof that you had creditable coverage so that you don't get the Part B late penalty. And same thing on the Part D drug plan. You're supposed to sign up for that at 65 if you don't have other coverage. So you had this coverage through your employer all that time. Well, what happens is when you sign up for the Part D drug plan, they are going to send you a letter in the mail that says, by the way, we see that you're over 65. Have you had drug coverage over the last few months? Let us know, or else we're going to penalize you. You're going to get a penalty. Well, 2 things happen. First of all, people miss the letter altogether. They get so much Medicare mail that they throw it out with everything else. Now they get hit with a penalty. And on the backside, my client service team is helping them try to appeal that. During that time, they have to pay the penalty the whole time to keep their coverage in force while we're fighting the penalty. So that's number 1. But something people also do is when you leave that employer insurance, any group health plan that you ever leave, around 2 weeks after you leave that group health insurance, your last day of coverage, they will mail you a creditable coverage letter to show anyone else that you need it for that you maintained this credible coverage. Well, they could ask for that. So if you miss that on that Part D and you don't fill that letter out and we're appealing, they might say, well, you missed it. So we want to see proof that you had that creditable coverage. Well, if you threw the piece of mail out that you got from your former insurance company, now you're trying to go back to an insurance company that you haven't been insured with, maybe for years, trying to get them to send you another copy of that creditable coverage letter. So number 5 is about make sure you save your creditable coverage letter and make sure you don't miss the notice from your Part D company where you have to testify that you had a drug coverage. And that's the reason why you are enrolling late for Part D.
Okay.
Gotcha.
It gets more and more confusing, right, Jackie? We got a few more to go through. So let's do a little bit of a lightning round because we've talked about some of this.
So this one, I don't think I knew this. Okay. So assuming that pre-existing conditions don't matter.
Yeah, that's right. Because remember, we only get the one-time 6-month open enrollment window for Medigap in most states. Now, if you lived in New York, you could wait until you got sick to sign up. And that's why the plans in New York are outrageously priced because the underwriters can't underwrite the sick people. But in most states, around 40 of them, you're going to have to go through underwriting. So you don't want to assume that you're healthy at 65. I know I want a Medigap plan, but right now I'm healthy enough. I'm going to risk this for a couple of years. And then you get sick. You wait until October 15th, thinking that you can call us and get a Medigap plan with no underwriting. And you get told by us the annual election period in the fall from October 15th to December 7th has nothing to do with Medigap plans at all. It is a time for you to change a Part D drug plan or an Advantage plan. And you missed your 6-month window to get a Medigap plan. So now you have to go through underwriting. You may or may not be approved.
Well, as we know, you're healthy until you get sick. My wife got breast cancer this year, and on April 1st, she went from being the epitome of health to a woman with breast cancer and other issues. Luckily, we've recovered, but we were prepared for that. We were insured for that. And you can't plan on when you'll need drugs. You can't plan on when you need care, and insurance is supposed to be there for those things. So I would encourage everybody to over-insure and not cut costs just because they think they're healthy.
Not on something this important, because think about this. Statistically, you'll probably never file a homeowner's claim. Very few people do. Most people will file an auto claim, but there are some people that don't. Pretty much everyone's going to file a health insurance claim. It's the most important insurance that you'll have.
Right, right. So let's see. This next one is canceling Part B because you joined a Medicare Advantage plan. We talked a little bit about that.
Yeah.
Okay.
So this one's pretty brief since we discussed it, but just because you have a zero premium advantage plan doesn't mean that you don't pay for Part B. So
Right.
sometimes people miss this. They cancel Part B, which cancels their advantage plan. Now you have lost Part B and you have to wait until the following January's general enrollment period to add Part B in. So you're going to go the whole year with just Part A coverage, which means you're paying
Ooh.
100% of your out-of-pocket expenses for outpatient out of your own pocket. And so make sure that you read the fine print and
Yeah.
know that even if you have a zero premium advantage plan, you have to stay in that Part B.
Yeah, you're
Yeah.
paying zero, so you're paying something. You have to realize that you're not paying for it. Paying null
Yes.
means you're not paying zero.
Correct.
All right. So number 8 is confusing your Medigap open enrollment window with the Medicare fall annual election period. We did talk about that,
Yeah.
but just reiterate for us so that people don't mess these gaps up.
Yeah. So just remember a Medigap plan, you can apply for that anytime, all year long. If you're outside of your one-time 6-month window, you're probably going to go through underwriting, but that's fine. We have people that start with a Medigap plan, they get a rate increase, they call us, we shop to see if anyone else is cheaper, they apply, go through underwriting, and many are approved, right? But with a Medicare Advantage plan, because they do not have underwriting questions, they limit them to that period of time, October 15th to December 7th. That is when you can get into or out of or switch your Part D drug plan or an Advantage plan. It does not apply to Medigap plans. And so that is a mistake that people make, and it never fails. On October 15th, we get calls from people every year that want a Medigap plan and didn't realize that they may have lost their opportunity because now they have a health condition that will prevent them from getting it.
Oh, wow. Yeah. Okay. So the next one here is asking your doctor's office the wrong questions. I'm sure I would be guilty of that.
Yes, this is a really important chapter because people get it wrong all the time. So, doctor office staff, I wish I could tell you that they totally understood Medicare, but they simply do not. My client service team has to have calls with these people all the time, educating them on how our clients' coverage works. Medigap plan, remember, the only question that you're asking your doctor is, do you take original Medicare? If your doctor says yes, your Medigap plan will work how it's supposed to. You don't have to ask if it's Blue Cross Blue Shield or Humana. Just ask, do you take original Medicare? Your Medigap plan will pay just like we have told you here today in this podcast. With a Medicare Advantage plan, remember, you have a network, but there might be an HMO network and 2 PPO options, all from the same carrier. So let's just use Blue Cross. Everyone's pretty familiar with them. They might operate 3 or 4 Advantage plans in your area, and all those networks may be a little different. So if you go into your doctor and say, do you take Blue Cross? They might mean, yes, we would take a Blue Cross Medigap plan, but they don't take the HMO plan that you're talking about. And so you could ask the wrong question, and most of the doctor's office give wrong answers. So when you are enrolling in a Medicare Advantage plan, you want to check the directory that is online from the Advantage company. That is the standard that is to be correct and is updated every 24 hours by most carriers. So you don't want to rely on something that you asked your doctor if you didn't ask the right questions, and they may not have understood and could also give you the wrong answer. So with Advantage plans, you always want to check that provider directory that is provided by the plan online. Search for your doctor to make sure maybe your doctor takes the PPO but not the HMO. So if you just said Blue Cross Advantage, he or she might say yes, and they didn't realize that there was another plan that they're not in the network with.
Yeah, you got to reverse engineer these things where you
Yeah.
take the prescriptions and plug them into your software to see which prescription plan D is best for you. And you'll take the doctors and plug them in also, right?
Right.
To tell them if they're in the network that you are picking and paying for.
Yes.
So it must be reverse engineered so that you get what you're buying.
Yeah, so that makes sense. So for this last question, I feel like this happens with our employer group health insurance now, where we just automatically stick with the same plan every year. So it's a mistake that happens a lot with Medicare too, failing to review your coverage every year.
Yes. So every year, your Part D drug plan and your Advantage plan are going to change all of their benefits. Medicare changes the Medicare Part A, B, and D premiums, deductibles, copays. And so all of the plans have to adjust to the next year's premiums, deductibles, and copays. So they could change your doctor network. They could drop a prescription that you take. They could move a prescription from tier 1 to tier 4, and it's going to be more expensive next year. They could change the copays that you pay. They could change the deductible. The coinsurance may go up or down. Your premium may change. And so they have to send you an annual notice of change every year in September that says, here's what's changing next year on our plan. Well, you might think, I love my plan. I'm not going to bother with shopping it. And then you go to the pharmacy counter on January 1st, January 2nd to fill your medication, and they ask you for $400 because your plan doesn't cover that anymore. But you never reviewed that annual notice of change. It's sitting in a stack of Medicare mail this high in your desk or kitchen table. And now you're in a drug plan that doesn't cover a medication that you need. So this is the same thing with Advantage plans. We need to make sure every year that everything about that plan that you like is still going to be the same next year, and that you don't get caught off guard by a premium increase or a copay increase or a medication or a doctor dropping off the network. This type of insurance, Medicare Advantage plans and Part D, they require a little bit of homework from you every year.
Yeah, it's not a set it and forget it situation.
Correct.
There's a lot of moving parts, and every year your Part D and your Advantage plans are going to change. There's less variability when you're in traditional Medicare, but in a Medicare Advantage plan, you've got decisions to make every year. And with your prescription drug plan, both on the traditional Medicare and the private side, you have decisions to make as well, correct?
Yes.
Okay. Well, there are 5. That's a great segue. How did I do this? There are 5 major decisions you must make, and I'll go through them, and then maybe you want to have some closing comments on what you think about these then. Determining your best time to enroll. You've got to decide that. And will you need prescription drug coverage or not? That's number 2. Number 3, choosing which route you'll go with Medicare. I assume that means Advantage or traditional.
Mm-hmm.
And choosing which insurance plan you should select. And that's like the subtypes under the Medicare Advantage.
Correct.
And should you stick with your coverage or change it? So these are questions you ask yourself almost every year.
Annually. Yeah, that's right. Now, the good news is once you enroll in Medicare Part A and B, you don't have to do that part over every year. You're enrolled in those unless you were to cancel them for some reason. And the only reason you would ever cancel Part B is if you went back to work for a large employer that's providing you outpatient coverage, then you might drop Part B and re-enroll in it later. So A and B, you only have to do once. But all of those other things where you're deciding which type of coverage you're going through, are you keeping it? Are you changing it? These are decisions that you're going to think about at least once a year, either when you get your rate increase from your Medigap plan or in the fall when you have the annual election period and you might be thinking about getting into or out of an Advantage plan.
Yeah, and remember that going backwards from Advantage to Medigap requires underwriting, and you might be denied. So you got to think about those cost issues up front, because we don't get healthier as we age. We just don't. We all deteriorate at some level, and we're all going to engage with the medical care system. And I hope that you guys never see me in the ER on the worst day of your life. So take good care of yourselves. Your health is your wealth, and we forget to do that. We worry about the money. We don't worry about these aspects of our financial plan. All right. This has been awesome. Danielle, any closing thoughts for late starters, people that are catching up to FI and catching up to Medicare?
Fortunately, today, there's so many great ways that you can educate yourself. So you can go to the Medicare.gov website, which has been completely redesigned in recent years, has a lot of great information. You can go to YouTube. There are thousands of videos about various Medicare topics. Our channel on Boomer Benefits is there. If you didn't get enough Danielle Roberts in your life today, that's a great place to go and start. You can go to our website, boomerbenefits.com. There are books available on Amazon. There's lots of ways for you to get information. So whether you're an audio visual learner or a reader, that information is out there for you. Just take the time, set aside an hour a week in those years leading up to 65 to start thinking about these things. And then this decision won't overwhelm you when you turn 65.
Yeah, I mean, let's name that website, because again, it's boomerbenefits.com. That's BOOMERBENEFITS.com. And then I got this, I'm holding up in front of everybody, the 10 Medicare mistakes you can make. I'm starting into it and I'm finding it fascinating. I did not fall asleep reading it. And it's actually in big print on purpose for us older folks that need glasses. So I've still got to read your book and finish learning the language. But I want to know, in closing, what in your crystal ball do you see happening with Medicare going forward, and what do you wish to see?
Well, we have some concerns about the solvency for Medicare because it is a very expensive national program, but it's also a beloved and necessary program. And so you always hear about how in just a couple of years, Medicare Part A will not be able to pay out 100% of its benefits because the trust funds are running low for Medicare. And at some point, we need the two sides of Congress to come together to create a permanent solution for this. There are lots of proposals out there. There have been proposals, for instance, about extending Medicare's enrollment age to age 67 or even age 70 to respect the fact that people work longer these days. And maybe if we started Medicare later, then Medicare needs less money in the trust fund. That's just one of the examples. But when we see Medicare deal with other problems, often what they come up with is just sort of kicking the can down the road. They might spot some money on a particular problem just to push it out another year so they can deal with it later. But until we have both the Republicans and Democrats coming together on some bipartisan review of this, we remain in this situation where we're only a couple of years out from the Medicare Trust Fund not being able to pay the expenses for Americans on Medicare. And please write to your legislators and tell them that you are concerned about this, because this is a program that we can't risk that at some point suddenly Medicare Part A only pays 90% of your hospital coverage. We need it to stay the way that it is. And there's some solutions to be found if they would just work together.
One thing you mentioned to me as a doctor hits home with me is there's a doctor problem and a doctor fix. What do you mean by that?
So in past attempts to come up with ways to extend the solvency of Medicare, one of the things that they did is they created this decreasing payouts to providers. And so it always comes up where it's time for the next 2% cut in provider payment. Well, we already have a shortage of providers in the nation for primary care doctors especially, but even specialists. And we already know that they make a lot less money seeing a Medicare patient than a person on group health insurance under 65. So whenever this comes around, you see the AMA and a bunch of other pro-doctor organizations fighting this cut in their pay. So at the last minute, Congress usually comes up with a fix and the payment never goes down to them. They come up with something that kicks the can down the road, as I said, just a bit. But we have to come up with a permanent solution, because the solution that they put in place for keeping Medicare solvent by slowly reducing what we pay providers isn't happening. So now we have to find that money come from somewhere else. And what I don't want to see is we get right to the verge of being insolvent, and then we're always at the last minute coming up with funds to further kick the can down the road. Medicare is a very, very expensive program, and we need to come up with some solutions that are going to make sure that it's there for future generations.
Yeah, we would encourage our audience to reach out to their representatives and help them understand our needs. And if you want answers to your questions, go to boomerbenefits.com, watch Danielle's webinars, and then reach out to her staff. They'll help you answer your questions. And I certainly will myself. This has been a great show, a very well thought out show. I thank you, Jackie. I thank you, Danielle. Jackie, any final comments before we see everybody else on next week on Catching Up to 5?
Yeah, just excellent information, Danielle. Thank you so much for being a leader in this space. And you mentioned webinars that you do, your website, your YouTube channel, your book that you put together. I am just thankful for content creators and experts like you that are openly willing to come on a podcast and share all the knowledge that you have. So it is out there. I consider you to be the greatest leader in this space. So follow Danielle, find some of her resources that we mentioned. We'll have links in the show notes. So we were just honored to have you to share all of your great knowledge with our audience.
My pleasure. Thank you both.
And I'll see you tonight at your webinar. I signed up.
Ooh, fun. Okay, sounds good.
All right, guys. We'll see you next week on Catching Up to 5.
So, Bill, as you know, we cannot do this show without our amazing staff and the people that help us put this on. So our social media is Diana Falk, our editor, Fritz Bassard, and show notes are done by Sarah von Sternberg. We love them and they keep us going.
Yeah, I mean, this show wouldn't have the quality it has without our folks, our peeps. And we'd also like to give you a few calls to action for the show. We love our community and we hope you love us back. If you want to support the show and what we're doing, you can do that at Buy Me a Coffee, which is a platform that allows you to virtually say thank you if you get value from our content. The link is in the show notes, or you can head over to our website at catchinguptofy.com and click on the Support the Podcast tab at the top right. We hope you've enjoyed this episode of Catching Up to Fi. We would appreciate it if you could leave us a 5-star review so that our message can reach others.
While we are financial educators, and I'm a financial professional that loves to teach, our content is for general education and information purposes only. We are not providing financial, legal, or tax advice. Always do your own research or consult a professional before making important decisions.
We'll see you next time on Catching Up to Fi.